Welcome, gentlemen and some ladies. Thank you for coming this evening. Gosh, what a good turnout. We were just remarking that it was better than the menopause turnout, so that's fantastic. Congratulations. My name's Jane Mangini. I'm a clinical nutritionist and sports nutritionist. So I'm just going to talk about food and muscles and exercise and all of those sorts of things that keep us all healthy and strong. But I wanted to introduce the panel tonight, but I'm sort of going to have to stand back. Okay. I don't know where I'm going to go. I don't know what to do with my hands. Okay, I've got Alex here, Alex O'Byrne. She's our registered counsellor, and she's here at Remede. I've got Dr. Richard Newton. So he's our, what do you call yourself? Like you're a GP, but you're special, like a specialist GP. And has a keen interest in men's health.
What about that?
Yeah.
Regular GP.
A regular awesome
Interested
GP.
in other disciplines.
Yes, and there we go. Julia Smith, she is a naturopathic medicine practitioner.
Well done.
Oh, wow. And then I've got my mate Adam, who is a traditional Chinese medicine doctor. So between all of us, we're going to be able to answer most of your questions, I think. So again, thank you for coming along. We all practice here, and you can come and see us all at any time. But what I thought I'd do is I'd just throw some general questions to the practitioners. And then if you want to ask questions yourself, you can ask questions, or we can wait until the end and we'll just keep it fairly loose. You're more than welcome to have another on a non-alcoholic beer, because that's sort of, you won't get drunk, so that's fine. So I think I'll start with Richard, because I suppose, everyone loves a doctor, don't they? The doctor's up there, and then we'll work around the edges like that. So Richard, I'm going to sit down now, because, I'm just in here, I get comfy like that. Well, obviously we're all aware. Is anyone living with anyone menopausal or perimenopausal at the moment? Lucky you. Anyway, so there's a lot of focus on women's health and hormones at the moment, and it's become very in front of our face, and it's great for women to actually have a voice and be heard and be listened to, but rightfully so, men have also hormones that need tending to, and as we age, our hormones decline, and there are many other reasons that our hormones decline, and we don't perform as well in all sorts of areas that we would like to be able to. So I just wanted to ask Richard a few questions. Have you seen more male patients coming in with a testosterone buzzword?
Yeah, I have. I guess I've sort of put it out there, from time to time, that I have a bit of an interest in hormonal problems, and then the word sort of pretty quickly goes around, and before you know it, you can sometimes get a little bit inundated by people asking about, testosterone, and obviously there's such an enormous amount of stuff that people read on the interweb, on Google, and everybody's an expert these days.
Yes.
So. There's a lot of questions asked, and it could take a lot of unraveling.
Yeah,
as well.
Absolutely.
Yeah.
Okay. Well, I might continue along with that. So when someone's coming to see you, what sort of signs and symptoms are they presenting with that maybe they're already diagnosed themselves with low testosterone? What are the signs and symptoms they're experiencing and you're seeing?
Yeah, so often they're pretty general kind of symptoms, so fatigue obviously will be a really, really common one, lack of energy, lack of get up and go, not wanting to do the things they would normally enjoy doing. Weight gain is often a really important part of it. Mood problems, really, really common. Depression, low mood, sense of brain fog, difficulty concentrating, not being as mentally sharp as previously, difficulty in putting on muscle in the gym, keeping the muscle on, and libido problems as well.
Yeah, unfortunately. So I just wanted to, so that's what we're seeing, and I won't ask for any show of hands of who's experiencing any of those, but there's a lot of reasons where it's a very big umbrella thing. It's not just testosterone, and we want to touch on all of the other health implications that can be affecting those signs and symptoms, and they may boil down to testosterone, and there's some specific testing that we can do. But just while we're on mood, with Alex, our counsellor, I've got my questions written down, so just bear with me. So basically, how do hormone imbalances affect men's health with regard to mood, and how do you help men with their mood, and what do you see?
So as Richard just pointed out, he sort of will focus on the biological component with these specialists here, and then obviously I'll be looking at So is this sort of mood changes out of character for you?
Yeah.
Is this something that you've just noticed recently? But I guess also just digging a bit deeper to what is the root cause of why you may be feeling this low mood? Are you feeling more stress at work? Is there something going on in the household? Relationship issues? Maybe parenting challenges? So doing a bit of a deep dive into understanding what's actually going on. There might be some unresolved grief or trauma from childhood. So first of all, it's just really understanding what's being presented with, but then also giving psychoeducation and tools around, okay, well, how do we actually tune into our nervous system and work within our window of tolerance to basically come up with ways to self-soothe, to regulate, to to sort of change those feelings into good thinking and good behaviours.
Because the mood and the stress definitely affects families and partners and work relationships. So Julia, my question for you, I'll just refer back. So how does stress and sleep affect men's hormones?
Such a good question. I think, if I think about most of the men that I work with, if I ask them in the first consultation, how stressed are you? Or how does stress show up in your life? The question is often sidestepped because I think men are socialised to accept stress and just feel that they should be able to handle stress. And maybe it hasn't been as positive a conversation in the past for men to admit that they're feeling a bit fragile or that they're under pressure. So I think it doesn't always show up as stress, but it sometimes shows up as IBS.
Right, irritable bowel syndrome, for sure.
Exactly, or insomnia. Or fatigue, or general sort of, my brain isn't working the way it used to, because stress affects the particularly high pressure and executive function. It all happens in the prefrontal cortex, and if we're under long-term pressure, that prefrontal cortex just stops doing its work as well as it used to. So decisions are harder to make. We just don't feel as mentally focused. And this is true of all genders, but I see particularly in men that it shows up in other ways. And so it's often in the second or third conversation that we start to really dig into what's happening in the adrenal function, the brain function, and how we can resolve that. But definitely stress, I think, in terms of sleep, sleep's a really easy one to notice. If we're not sleeping as well, if we're not waking feeling refreshed from a good quality sleep, then that is a symptom of stress, but also is stressful on the body.
Absolutely. I mean, I know with sports nutrition, a lot of guys are like, just punch on, you can sleep when you're dead and all that sort of hero talk. But if you're getting 5 hours, you have a 70% more increase of obesity, and along with that is diabetes and then heart conditions and all of those sorts of things. So I do say that no one is going to give you a trophy for being the person that has the least amount of sleep. Like, you're not winning anything. So just talking about sleep as well, Richard, what we discussed sleep apnea quite a bit. How does that sort of hook in with men's lifestyle, hormones, stress levels?
Yeah, so, testosterone problems, they're usually a secondary effect of something else going wrong. It's very rare that it's the primary condition.
Yeah, right. So like a chicken and an egg sort of thing.
Can be in some uncommon cases, like, for example, people have had to have a testicle surgically removed, or they've had chemotherapy or something like that, But most cases of a testosterone deficiency that we see will be secondary to something else, and obstructive sleep apnea is one of the most common causes of that problem, and that's very often undiagnosed. It's very often missed. So it's really important that we screen for those sorts of conditions so that we know we're actually treating the right thing.
And how do you start the screening process for that?
So for sleep apnea, obviously you can get a certain amount from the history, but it tends to be pretty unreliable. There's some scoring systems that we can use, but again, they tend to be fairly unreliable as well. But, that history of maybe people who snore a lot, maybe the partner has noticed that they might stop breathing at night or wake up in the middle of the night and give a great big gasp as though it's their last dying breath, and when they wake up in the morning, they have that sense that their sleep has been really unrefreshing, and it's often people who are overweight, but by no means always the case. Some people can have obstructive sleep apnea as well, and we would have a pretty low threshold for trying to get people to go and get a formal sleep study done.
And we send them off to do that?
Yeah.
Yeah. I personally have sleep apnea and have had it for probably about 5 years, 8 years or whatever, and I had no idea that I had it. And I answered a questionnaire that was like, when you settle down to watch TV, do you fall asleep? And I was like, oh. And, have you ever fallen asleep while driving? And I was like, And I got strapped up and did the test, and it was quite surprising. So it doesn't necessarily, you don't have to be overweight and have a lot of fat around your neck or of age or whatever. And it's definitely helpful to be diagnosed and treated, that's for sure. So then we've talked about signs and symptoms. So Richard, what other conditions can affect men's hormone levels?
Well, obviously obesity is a common factor there, and then there's a bit of a chicken and egg scenario going on, because obviously a low testosterone will contribute, to obesity, but obesity is a very, very common cause of low testosterone as well. So it's kind of breaking out of that cycle, which is really, really important. Other things, obviously very commonly associated with metabolic syndromes and type 2 diabetes, hypertension, high blood pressure, and often low testosterone will be secondary to mental health problems, depression, anxiety, trauma, those sorts of conditions.
Absolutely. And that's where I jump in and just bang on about muscle mass and protein. So I've got, I'm a sports nutritionist, so I do a lot of measuring of ladies and men's, not just weight. I'm not really interested in what people weigh, but I'm really, really interested in muscle mass and how we're holding on to our muscle. And when you don't have a lot of muscle mass and you don't take the time to build your muscle, muscles actually and exercise actually increase our testosterone levels. So even cardiovascular exercise, so going for a walk or a run, but lifting weights and building muscles sort of cyclically help build testosterone. So I'm obsessed with helping people build their muscle, and it definitely is all about diet as a fundamental. Eating enough protein, enough good quality protein, and not having a piece of toast or whatever for breakfast and then a bowl of I've had one lady say to me, I'm pretty good during the day. I have some pad thai noodles. That's quite healthy. And I was like, no, it's not really. Because that's like just a bunch of deep fried noodles and you're not really getting any good quality protein. You're just getting a lot of high glycemic carbs. So diet and food are imperative, but building muscle. So when I was researching, how are we going to pull this all together? And I was like, watch, and I don't know if anyone else has seen it on the internet, the aging test you can do, and can you get off the floor without using your hands? And I was going to get everyone to do it, but then I thought, that's a bit name and shame. Some people might not be able to do it, and some people have arthritis, but could I get someone to demonstrate? But anyway, when you're home, just Google it and sit on the ground and then get up without using your hands. And it's a longevity test. It's all over fitness and wellness test. And the other one, and Julia's going to talk about it in a minute, is the grip strength. So it's sort of like, well, how strong does your hand need to be? But that is an indicator, and I've written all my stats down here, but that is an indicator of longevity. And if you have a good grip strength, you are setting yourself up later in life to actually be independently living. And I know it's not sexy to talk about mobility and walking frames and getting yourself off the toilet, but that's why we actually build muscle, so that we can not just live till we're old, but live independently and well and healthy till we're old, and wipe our own bottom basically when we're 80. I don't know. Surely some of us are dealing with elderly parents in a bad situation that maybe haven't looked after their health, and that's why you're here tonight, because you're staring down the barrel thinking, well, I'm not going to end up like that, and I really need to build some muscle. So Julia, tell us about the grip strength.
So grip strength is a really good indicator of your longevity, as you mentioned. I work a lot in the cognitive health space, so I like to do this for both men and women, just to test what their grip strength looks like, whether they're concerned about their cognitive health in the future or whether they have been diagnosed with dementia and Alzheimer's. It's a really good way to measure the muscle quality, not just the quantity of muscle, but the quality. We were talking about an interesting conversation earlier on about a comparison with a bodybuilder, young bodybuilder who had lots of muscle quantity but didn't have the strength and that's because the quality isn't always there. Whereas someone else who is his father had really good grip strength. So it's a really good measure of how we're going to do in our older years
fantastic.
in terms of cognition. Who wants to give it a go?
Who wants to be the... Oh!
Excellent job.
Okay, set it to female.
I'll make sure we set it to male because so that's male first, if that's okay. Yep. Rare is me first. So Nutritionist's going to get you to hold it in your right. Yep, beautiful. And give it as, give it a start. Practice there. There you go. As strong as you can. Hold. And you can let go. Great, so that's 37.2 kilos, so that's very normal for a man. Well done.
Good job.
It's going to get competitive.
That's when you know alcohol.
Mine's not. I've got arthritis.
You've got reasons.
Yeah.
That's your dominant.
You've got a sick name for it.
Have I what?
You've got a sick name for it. Medical stuff.
Yeah, I do have a sick note. Can't be doing that. Anyway. And so why do we need good grip strength? Yes, it's an indicator of longevity and mobility, etc. But you want to be able to open your burger pickle jar when you're 70, don't you? With your beer. Now, does anyone go to the gym? Does anyone do a little bit of training? This is fantastic. So a couple of ways you can actually increase your grip strength is any sort of pull-up or chin-up sort of thing, or just hanging from a bar. Like go to a playground outside and actually just try and hang from a bar and get better and better. The other test you can do, it's a bit of a test, and you can build up to get better grip strength, is called a farmer's hold. It's when you get a dumbbell in each hand and for a minute you walk, just looking straight ahead, just walk slowly with the dumbbells, and I'll tell you how much they should weigh in a minute. And you do it for about a minute and you walk, and I promise you, I've done it myself, obviously, and it's not just about grip strength, it's actual all over body, like, oh, my hips were hurting, it's core strength, it's everything. And they say you should be able to carry your body weight. So that's, say, if I was 80 kilos, I'd be doing 40 kilos and 40 kilos, but don't go and do that tomorrow because you may hurt yourself. Build up slowly, but it's a really good indicator of how your strength is gaining the longer you can hang on a bar or the longer you can do the farmer's hold for. So, yes, now Julia, some other testing. No, I think I might actually chat with Adam for a moment because as a traditional Chinese medicine doctor, tell me about how you can support the production of testosterone.
Okay, so we still see, we look at it the same way. We look at it to make sure that the person is sleeping well, they've got a good healthy diet, that they are exercising. And from there we actually target more, we're looking at the kidney, and not the kidney as a filtration device, but actually more the kidney essence. The kidney is what we consider what gives us our longevity, and the kidney is also responsible for the hormones, both male and female. And so we target and strengthen the kidney in order to produce the testosterone production. We can do that a number of ways with actual manual treatments, but also different herbal tinctures. And even just the acupuncture alone is working with, it helps to better the communication between the brain and the testes for the testosterone production.
Fantastic. And so stress, as Richard said, it's not usually low testosterone that's the first problem, it's something else that is then leading to low testosterone production. And stress is a massive one. Sleep we've touched on. So how does traditional Chinese medicine help with reducing stress?
Sometimes stress can be caused from heat, excess heat in the body. It raises the head, it just elevates your mood, and it can affect your ability to get to sleep. It's hard to sleep if your head is full. So we like to try and eliminate some of that excess heat first. So we can do that with herbals, you can do it with tea. Green tea is a really good one, a very simple one to help remove that pathogenic heat from the body. But another way, again, is the acupuncture itself. Just when you put a needle in the body, it's responding via the nervous system to the hypothalamus, which releases hormones into the body. like dopamine and cortisol, just to help us to calm ourselves down.
Cool. And if anyone here is nervous of needles, how do you approach that?
You don't have to look at them. No.
Okay.
Or face down.
You do, I do.
Yeah.
You go.
Look, the needles, I guess even myself, I hate the idea of having a needle. I hate a hypodermic needle. I hate having my blood taken. I hate injections. And whenever I have that conversation with the needle bearer, it's always kind of uncomfortable when they hear I'm an acupuncturist. But the needles themselves, they come in different various grades and sizes, but more often than not, they're about the thickness of your hair. So they really are fine, very super fine surgical steel. And more often than not, you don't even feel them go in. So they're very delicate.
So you could go in a bit stressed about the needles, but once you've done them and placed them everywhere.
There are some needles we actually use to target, like the top of the head. There's even some in the wrist that we use just to help calm people down.
Okay, so it's a good modality to just for an overall stress reduction. So then back to you, Alex, talking about stress reduction. What are some of the best strategies you like to use with your clients to get them sort of managing their stress a little better? Often we can't change circumstances, but what would you recommend?
Look, I think Julia's sort of touched on the sleep, but looking at what is their presenting issues, but then I think it's really about, okay, so how can we create some better habits and boundaries around maybe work or life, creating rituals around when we get home, how do we decompress before we're on the onslaught of children, relationships, family. But again, also touching on what some of the other practitioners, it's really about the autonomic nervous system. So how do we actually tune into when we're feeling stressed, and how do we actually learn how to regulate those feelings? So maybe if we're in our head and we're overthinking and we're looking at, we can't sort of switch off when we get home. So that might be a warning sign that, hey, I might need to decompress, go for a walk, do something before I actually go into my home life. Stress is a hard one because we've got this sort of like really ancient software system in our body that's 60,000 years old and it hasn't caught up with modern life. So it's really about getting that together again and tuning in.
I love that strategy. I went to a conference once and saw Dr. Adam Fraser talking, and he's written this book called The Third Space, and it was exactly that. It was about, we're so busy and we get so caught up and we're on all the time. We don't get a break anymore. We're on our phone. We're contactable by work, blah, blah, blah. And he said you need to do something have your work and then something completely separate before you walk into the home.
What's the ritual around that to separate the mind from work to
Exactly, because we're so busy, we just sort of rush inside, dump the bags, put the apron on. But we're then into kid and house mode and blah blah blah. So he actually in his house designed a separate entrance. So he would go in the separate entrance, have a shower, relax, put some clothes on, and then he was fully ready for his family because he had a young family.
And sometimes taking your work clothes off and actually putting your home life clothes on is that separation. You may need to have a shower, washing away the day.
I love the washing away the day. I obviously am a massive advocate for exercise for stress release, and it's all the studies say, and that's also going to help us build testosterone. It's going to help us lose weight. It's going to help us build muscle. So it's actually a non-negotiable.
And the bilateral movement of walking. Is really great to regulate the nervous system.
Fantastic. So even if you just parked your car and just went for a little walk and then came in at home, that's great. So I wanted to talk about testosterone. We've talked about signs and symptoms and some other factors that are affecting low testosterone and what we might be looking for. And when you sort of think, well, I think I might have low testosterone because I'm moody and I'm grumpy and I've got all these other things, but we need to know. We need to test, not guess. And so there's a lot of tests in all our different modalities of what we do. So I like to I ask a lot of questions around, stress and all of that, but I like to use a set of scales as a sports nutritionist that would measure weight and body fat, but muscle percentage and muscle increase. And I had a client a couple of months ago who was just running in court, and very stressful. And he came into me, and I had to really set him up, really fortify him to take on all this stress. And I noticed some of the key things that, I ask a million questions, surprise, surprise. And he sort of basically said he doesn't really eat until about 2:00. And, he trains with weights, but only twice a week. And, then he would just get exhausted. And I was like, well, we're going to refigure everything because we have to get you through this court pro system. And so I got him training 3 days a week, right? So he was doing twice a week, and I bumped him up to 3 days a week. And I was like, dude, you have this window of opportunity when you've worked your muscles to make sure they are growing, and that's your anabolic window, and you need to eat straight after. Like, get yourself on a good protein shake, grab a banana, whatever, but that needs to happen. So he started off by having a good breakfast, and he then had his shake. He moved his weight training up to 3 days a week. He came to see me, it might have been 5 weeks after he had started this. He was like, oh, Jane, I've put on weight. And I was like, well, you're not walking much, you're in court all day, we'll deal with that later, but let's pop you on the scales. And in fact, he had put on weight of 1.3 kilos, which wasn't much, but then when we looked at the data, he had actually put on 1.35 kilos of muscle just from eating good quality protein and training that extra day a week, which then is going to enhance his testosterone production, reduce his stress, etc. So that's the test I use. But Richard, how do you test for, you know, testosterone? What do? You just like go online and send yourself off a test, or?
Yeah, so I think that's an area where things often do go wrong, you know, and it's often really poorly managed, I have to say, you know, in primary care. And, you know, I guess we're quite lucky here at Remede. We have much longer appointments, and, you know, patients are well motivated, so it's a nice environment to work in. But, you know, it's really important that when we're looking at possible testosterone issues, you know, we're doing pretty thorough testing. So, you know, in addition to doing things like we were talking about sleep studies and so on, you know, blood tests wise, how I tend to do it is I actually give our patients 3 sets of blood forms. I do 3 blood tests over the course, usually of a couple of weeks or something like that, so a few days apart, because testosterone in itself is a very dynamic hormone. It will go up and down all the time, you know, depending on what you've been doing the day before, how good your night's sleep was, all sorts of other factors like that, how much exercise you did. So I think it's really important to do at least 3 blood tests over a couple of weeks there, so we can get a nice sort of mean value there.
Fantastic.
Okay? And when we're doing testosterone, we're doing a total testosterone, we're doing an SHBG, which is a sex hormone binding globulin. So we're then getting a free testosterone level at the end, which is obviously the amount of testosterone you've got available in your body to use. And in addition to that, we'll be testing a number of other hormone systems, like we would be testing pituitary hormone function, because obviously one of the causes of a low testosterone might be your pituitary gland not working properly. We would often do an estrogen level as well. It's a good baseline, plus we'll be doing all of the other routine blood tests like blood count, iron levels, kidney, liver function, lipid profile. If our patient was overweight, we might well be doing a fasting insulin to have a look at things like insulin resistance. We'd often be checking thyroid function, vitamin D levels, and often would be doing a PSA as well, a prostate cancer screen, and that's particularly important because, you know, if you were going to contemplate using a testosterone replacement therapy, you need to be absolutely sure your patient hasn't got prostate cancer, because that's a testosterone-driven tumour. So it's really important to do this very nice sort of thorough series of blood tests, you know, with plenty of explanation in advance as to how you interpret the results, which is by no means black and white.
And tell me, so once you've done that really thorough testing and it seems really responsible, and, you know, somebody does, you know, maybe they've reached 55 and they're grumpy and they've put on weight and they're really, you know, but they have tried a lot of things and they've got the sleep fixed and they've got the nutrition and exercise fixed, and you have justified that maybe they could have testosterone therapy. What sort of results have you seen in these guys?
Yeah, so definitely, you know, for the right patient, you know, once you've hopefully gone through those foundational measures of, you know, sleep hygiene, exercise, diet, trying to avoid stress as much as possible, not always easy, you know. Testosterone therapy can be very life-changing for people. You know, we're not talking about trying to make people feel like they're 18-year-olds again. You know, that's just unrealistic. And we're not trying to get our levels, you know, super, super high. I mean, I've seen patients who've been prescribed testosterone from, online, or they've bought it in the gym, or, they've been to the USA. Terrible things happen in the USA, not least
Very
testosterone
much so, yeah.
therapy, and their levels are just off the chart, and they're
Yeah.
going to get all sorts of,
Yeah.
problems. But
Yeah.
if we can sometimes, get their free testosterone maybe into a kind of a nice 400-500 range from a 200 or a 150 or less, people feel a lot more their normal
Fantastic.
selves, mood improves, more energy. happier.
Fantastic. And I suppose it's just one of the tools in the toolkit of men's hormone and men's health. We've talked about mental health and exercise and reducing stress. So Julia, you run testing, and I think, you're quite apt at running DNA testing. What's that all about, and how can that support men and their hormonal health?
It can support men in so many ways. I really want to talk about herbs for testosterone as well.
Oh, well, what would you like to talk about
Well, just
first?
while we're thinking of, while we're in that space.
Let's talk about that.
Because there are, we talked about using herbs
Yeah.
for stress.
Yes.
And traditional Chinese herbs, and sometimes they cross over
Yeah.
the ones that we use as well. But there are a lot of herbal supplements that are very effective at boosting testosterone. Naturally,
Yeah.
not giving the body testosterone, but encouraging its own abilities.
Yeah, wonderful.
And I was reading a study, I printed it out so I wouldn't forget it, but I was reading a study just recently on Withania.
Yes.
So Withania is also known as ashwagandha. That's its Ayurvedic name, but it's been used for hundreds and hundreds of years by Western herbalists. So Withania was used in a trial of moderately obese men and women, and they weren't looking at hormones, they weren't researching hormones, they were researching outcomes. And
Okay.
all of these people were presenting with levels of fatigue. And what they found in the men was that their testosterone increased.
Wow.
By using a stress herb. So we think
Wow.
of Withania as being an adaptogen, good
Yeah.
for the adrenal glands, good for the stress response. But it was actually supporting their testosterone
Wow.
as well. So it was kind of a byproduct finding
right.
in this research, which I
Fantastic.
found amazing. But also we have herbs that specifically do work on male hormone production. And those are herbs like tribulus, you might have come across those. Tonkat alley was recently, last year, made available by the TGA in Australia. And that means that we can get good quality products, because Tonkat alley has been available. I've worked also in the sports space for a really long time. It's been available online for years and years and years, but when I've worked with guys who've taken it, it hasn't really worked for them, and that's because there's a variety of quality available online. Right now, the five of us could get together and make us product, and it could be great, or it could just be sourced from a poor quality source. So we tend to use herbs, and you can see the big wall of liquid herbs on the other side of the wall there. There are hundreds of them, but particularly for men, I like herbs like tribulus, Tonkat alley, Korean ginseng can be great. I do like the stress herbs, so things that work on the adrenal glands, because most of the men I work with are under high pressure, whether they're business owners or managing businesses. I spoke to a guy recently who has a horrible thyroid condition because he's been living for years on New York Stock Exchange time. He lives in Perth, but he has to work on this completely different time zone. And then his wife went and gave birth to a beautiful baby girl last year. And now his sleep is terribly interrupted. So surviving on, like you say, 3 or 4 hours sleep is very damaging, it's very stressful, and particularly to the thyroid gland. So that's having a negative knock-on effect to his...
Nice to just have that before you start your meal, to get those bit into it. I'd rather get up and go for a walk in the morning, and there's so many more non-alcoholic drinks and mixes. It's just boomed, that market, and it's a really good indication that people are taking their health seriously, like you guys tonight coming in. So thank you coming to meet us all. So we'll love to see you again, and all our cards, and we're all on the website and all our bios, so come and see us, and thanks for coming along tonight. Yay!